Welcome to the video answers for another Part 1 question set. Let's get started. First question, ceftriaxone is used for the treatment of sexually transmitted Neisseria gonorrhea infections. What generation of cephalosporin is ceftriaxone? Ceftriaxone is a third generation cephalosporin. Now, which generation of cephalosporins is effective against Pseudomonas? Mainly, this is the fourth generation cephalosporins like cefepime, but also a couple of the third generation drugs, specifically ceftazidime and cefoperazone. So not all third generations, just those two. Now, are cephalosporins bacteriostatic or bactericidal? Well, they're bactericidal. Remember, beta-lactam antibiotics like penicillins and cephalosporins are bactericidal because they interfere with cell wall synthesis, so the bacteria can't grow, they can't remodel their cell walls, so they die. Next, a 35-year-old white woman presents with a dull ache in her jaw that's made worse by chewing. She states this pain corresponds to a recent promotion and increase in responsibilities. So what's the most likely diagnosis? The jaw pain with chewing might make you think about giant cell arteritis, also known as temporal arteritis. But this patient's 35 years old. That's much, much too young for temporal arteritis. So this is TMJ syndrome. Classic patient with TMJ syndrome is a young woman in her 20s or 30s. It's the second most common cause of facial pain after headache. It's commonly exacerbated by stressful life events, like in this case. And then most patients with TMJ, about 78%, have nocturnal bruxism, or grinding of the teeth at night, or they have some unconscious jaw clenching. Now, there may or may not be clicking of the jaw as a symptom, but be aware that clicking of the jaw is not diagnostic of TMJ syndrome, even if you feel it on physical exam. Next, a patient is undergoing treatment with recombinant interferon for his hepatitis C. In what ways do interferons interfere with viral protein synthesis? Well, interferons induce the production of numerous cellular antiviral defenses, including an RNA protein kinase. So this is a ribonuclease that inhibits viral protein synthesis by degrading viral mRNA, but not degrading host mRNA. And then interferons are also involved in triggering pro-apoptotic pathways, and interferons also influence the activities of macrophages and dendritic cells. Next, your patient develops a cough with a new antihypertensive drug that you prescribed her. What are some other side effects associated with this medication? So first of all, you have to know which class of antihypertensives causes cough, and that's the ACE inhibitors. A dry cough is a very well-known side effect of ACE inhibitors. Then if the cough develops, you would stop the ACE inhibitor and maybe switch to an ARB, which has some similar benefits but should not cause a cough. Now, the other important side effects of ACE inhibitors include angioedema, which is a swelling on the oral mucosa, especially in the lips, but it can be anywhere from the lips down to the larynx. And that's especially dangerous because it can obstruct the airway. ACE inhibitors can also cause a little renal insufficiency, and they can cause some hyperkalemia. And they're also teratogenic, so we do not give them to pregnant patients. Next, in regard to seizures, what do the terms partial, generalized, simple, and complex mean? So a partial seizure means only one area of the brain is having seizure activity, most commonly the temporal lobe. A generalized seizure means that there's diffuse involvement of the brain. Now, a partial seizure can become generalized. In a simple seizure, consciousness is intact and the patient's aware that they're having a seizure. In a complex seizure, there's impaired consciousness. Next, how is thyroid hormone made and stored? So first of all, the epithelial cells lining the thyroid follicle bring in iodide out of the blood using a sodium iodide cotransporter. So you're using the sodium gradient to move iodide against its concentration gradient. Then once inside the cell, this iodide is transported into the follicle where it's oxidized by peroxidase. Then that iodine is bound to a protein called thyroglobulin. Specifically, the iodine is bound to tyrosine residues within the thyroglobulin molecule. This process of binding inorganic iodine to the organic thyroglobulin protein is called organification of iodine. And that all happens inside the thyroid follicle in the colloid. Then the first molecule that's made is monoiodotyrosine, or MIT, which has one iodine on it. And then there's diiodotyrosine, or DIT, which has two iodines. And then when you start linking all those together, you can get T3, which has three iodines, and T4, which has four iodines. Now, T3 is the actual active thyroid hormone, but most of what eventually gets released is actually T4, which is the body can convert that T4 to the active T3 out in the peripheral tissues. But both T3 and T4 remain attached to the thyroglobulin molecule. They kind of hang out in the colloid until release.
So the follicles of the thyroid can store about a 2 or 3 month supply of thyroid hormone. Then, when TSH comes along and it stimulates the thyroid gland, those follicular epithelial cells endocytose a little colloid and they bring it into the cell. And then inside that little vesicle of colloid that was formed by endocytosis, there are lysosomal enzymes that break down the thyroglobulin protein and that leave you just with the T3 and T4. And then those same vesicles undergo exocytosis over on the opposite surface of the cell and thyroid hormone is released. Next, a 35-year-old man is seen in the office for his chronic recurrent peptic ulcer disease. It's been refractory to conventional treatment with PPIs. Your attending mentions that this might be caused by a tumor. So what type of tumor may be responsible for this condition? Well, this could be Zollinger-Ellison syndrome, or ZE syndrome, which is where there's a tumor that secretes the hormone gastrin. Now, what does gastrin do? Gastrin stimulates gastric acid secretion, so this is a gastrinoma, a gastrin-secreting tumor. It's often found in the duodenum, sometimes found in the pancreas. Now, if this patient also presented with kidney stones and signs of hypogonadism, what syndrome might you suspect? Now we're talking crazy internal medicine diseases with a dozen seemingly unrelated problems. Gotta love it. So we've got ZE syndrome plus renal stones. Well, what's the most common cause of kidney stones? Well, most stones are made of calcium, so you think maybe this patient has some hypercalcemia. What's the most common cause of hypercalcemia? Hyperparathyroidism. Not much help. So let's think about the hypogonadism. You don't really expect to see hypogonadism in a 35-year-old man, but one thing you should think about if you see hypogonadism is pituitary disease, specifically a prolactinoma, a prolactin-secreting pituitary tumor. So does that ring any bells? You got a gastrinoma, a parathyroid tumor causing hyperparathyroidism, a pituitary tumor. Well, this is multiple endocrine neoplasia type 1. So if they give you a patient with peptic ulcers plus kidney stones, think about MEN1. Next, what's the role of clomiphene in the treatment of PCOS? PCOS is characterized by 3 main things: polycystic ovaries, obviously, androgen excess, and either anovulation or oligoovulation. So obviously, if you're not ovulating, you're going to have some infertility, and that's the role of clomiphene, to induce ovulation. So how does it work? What's the mechanism of action? Clomiphene is an estrogen antagonist that blocks the normal feedback inhibition in the hypothalamus, and it increases the release of LH and FSH so that the patient can ovulate. Next, a 49-year-old trauma patient comes into the ER unconscious and in need of surgery. What are the exceptions to informed consent? Well, first of all, in emergency situations like this, consent is implied. This patient's unconscious, can't give consent, but because of this emergency situation, consent is implied, so you can go ahead and operate. But there are other situations that you should be aware of as well. If a patient lacks decision-making capacity or is mentally incompetent, that patient can't give consent. Informed consent means the patient understands the implications of having the procedure and understands the risks involved. So if the patient lacks decision-making capacity, who's going to give consent? Well, the person who has power of attorney for healthcare decisions, or in most states it would be the spouse by default if power of attorney hasn't been formally assigned to someone. Another situation would be if you as a physician decide that giving the patient information would cause severe harm to the patient or undermine informed decision-making ability. Then you can choose to withhold that information. We call this therapeutic privilege. Now, I'd be very reluctant to exercise this so-called therapeutic privilege. Sounds like a recipe for disaster if something goes wrong and the patient or the family accuse you of not adequately explaining the risks. This would be exceedingly rare. I've never seen that done. And then a final one would be if the patient signs a waiver saying they give up their right to give consent. The patient basically says, "Doc, you make the decision for me." Or they're assigning the right to give consent to someone else, a family member or something like that. Kind of like a medical power of attorney, only in this case, you don't have to wait for the patient to become incapable of giving consent. The patient's just handing that right over to someone that they trust. Again, that's extremely rare. I've never seen that done either. Next, what are the side effects of amiodarone, and what testing should be performed periodically on patients taking it? So let's answer the last part of this first. The tests that you should monitor periodically in a patient who's taking amiodarone are pulmonary function tests, liver function tests, and thyroid function tests. So think PFTs, LFTs, and TFTs. Now, if you can remember that, it's going to help you remember that amiodarone will cause pulmonary fibrosis, which is why we measure PFTs. It can cause some hepatotoxicity, which is why we monitor LFTs. And it can also cause
thyroid dysfunction, either hypothyroidism or hyperthyroidism. It can cause either. And that's why we monitor TFTs, or at least TSH. Then a few other amiodarone side effects you should be familiar with are deposits in the corneas, neurological problems like tremor, ataxia, neuropathy, constipation, and then several skin problems like photosensitivity, and also a rare blue-gray discoloration of the skin due to accumulation of iodine, since amiodarone is about 40% iodine by weight. That iodine is also why amiodarone affects thyroid function. All right, that's it for this question set. I'll see you next time.